Welcome back to our show, Obesity Care with Dr.Kanica Yashi. I'm your host, Manal, and I'm hoping you guys are tuned in today. As you know, Dr. Yashi is our medical expert on obesity. She is board certified in internal medicine and obesity care. Today's topic is obesity in mothers and breastfeeding. So let's talk more about that with Dr. Yashi. How are you today?
Hi, Meenal. Thanks for having me again on the show. I'm doing very well. I hope you're doing good too.
Yes, I am. So let's jump into our episode, Dr. Yashi, and let's talk about this topic. I want to start by asking, this is a very unique topic. And can you say why is it important to talk about this?
Absolutely. So we know that motherhood is a very important time in a female's life. However, going through a pregnancy and breastfeeding is a risk factor for gaining excessive weight. That is one reason for why we need to talk about it. We need to acknowledge this as a cause. Secondly, we know that many cultures, and we well know that in Indian culture, when a woman gets pregnant or is breastfeeding, it is a lot about just making sure that the woman is constantly being fed. You know, we just have to make sure that she's feeding is what is always in people's mind. However, that is not the case, and that's not true, but that is one reason for why women in a lot of Asian or South Asian cultures end up gaining a lot of weight. Mm-hmm. And the third thing is the lack of knowledge by our female patients or women population about how much weight they need to really gain during pregnancy. Now, the first thing they should do is actually find out what is the right amount of weight they really need to gain during pregnancy. It's not always this 11 kilos or 12 kilos from their baseline. Some women who are already overweight may only need to gain a couple of kilos as opposed to somebody who's quite underweight, who needs to put on maybe a lot more than the other person. So this varies. So the lack of knowledge also about how much weight they need to gain is another reason for why women in their motherhood, end up gaining a lot of weight. And also, I just want to say that let's not forget that going through motherhood is such a difficult time. It's challenging, and many times we forget to take care of ourselves, in spite of knowing everything. So that is why I wanted to talk about this today and, highlight the importance of this particular issue.
Yes, definitely. So what kind of problems can the mother and the baby face due to excessive weight in the mother?
Right. So when the pregnant female puts on a lot of weight, and very difficult to lose it once, after the delivery. So obviously they are now in that overweight range or obese range. So that itself is a disease. They are now in the disease category of obesity. Also, going through pregnancy is a pro-diabetogenic state. So what that means is that when a female is pregnant, they are prone to develop diabetes or sugar problem. Such are the hormones running in the body at that time. To top it off with being overweight or obese and gaining excess weight, the chances of developing diabetes becomes higher. So that is the second problem. Obese mothers are also at the risk of developing hypertension, that's preeclampsia in our medical terminology. And not to mention, women patients who are pregnant, who are overweight and obese, are at higher risk of developing high blood pressure, also known as preeclampsia in our medical terminologies. And I mean, how we diagnose preeclampsia has some more criteria to it. but there is a risk of developing high blood pressure.
Mm-hmm.
Now, once the child is born, the female may experience delayed breastfeeding because the milk may come late, and that has been seen in overweight patients. So that is another issue. Yeah. And while they are pregnant or going through pregnancies, they have a higher risk of either having a very small baby that we call it as IUGR, intrauterine growth retardation in medical terminology. So very small baby because the baby is not developing well due to the mom's high or increased weight status, or the baby is very big. So the other issue is the baby can become so large that the female may not be able to have, a normal vaginal delivery and may have to go through a C-section and all those things. So that's the problem in the postpartum period or while having the delivery. We also know that children or kids born to mothers who are overweight have higher chance of developing obesity at a later stage in their life. So maternal overweight or maternal obesity is a risk factor for obesity in the child itself. And because of what I mentioned before, that there could be delayed feeding or in not a very good breastfeeding experience, the child may be formula fed or may not be able to have the breastfeeding experience, and that has been shown that the child loses the ability to self-regulate their eating habits. So either they become very undernourished or they become very overnourished or maybe obese in the sense. So these are all problems that can occur with women who are overweight or obese during pregnancy. And these are just a few that I could recall today.
Right.
Taiwan is encouraging new mothers to breastfeed. Not only is it good for the baby, it's good for the mother, too. WHO research has found that babies that are breastfed for less than 6 months are more likely to become overweight children. Pediatrician Ce Wei says breastfeeding reduces insulin secretion, and bifidobacterium in breast milk can help reduce the likelihood of becoming overweight. A WHO study of 100,000 European school children found that of all the children that were not breastfed as babies, 1 in 5 was overweight. Last year in Taiwan, 46% of babies under 6 months were exclusively breastfed, close to the WHO world goal of 50% by 2025. The Health Promotion Administration's Chen Lijun says breast milk is the most natural, so it's better for babies than formula. The WHO recommends feeding babies only breast milk for the first 6 months, and along with solids until the age of 2.
So not only for the mother, but it can be a problem for the child as well, which is okay.
Yeah, it can be a big problem. And we know that now there is enough data to support this, that it's a problem in children as well to gain unnecessary weight or unhealthy weight rather.
Right. So then what can mothers do to avoid excessive weight gain during pregnancy?
Right. So I think first is that they need to find out from their obstetrics and gynecologists or through their family doctor how much weight they really need to gain during pregnancy. Having that understanding is so important. I may be of a different weight, you may be of a different weight, somebody else may be of a different weight. They really need to know, according to their baseline weight, how much weight they really need to gain. That knowledge is so important. Once you know that, you need to stick to a right kind of diet. You need to eat healthy food. Maybe having a nutritionist or consulting a nutritionist on board or having their support can be very important. Staying hydrated is also very important. That is another factor. When we are pregnant, our blood volume has increased. So drinking the right amount of water is key. And then obviously making sure that at the right time during a pregnancy, one is getting screened for high blood pressure or diabetes, with their doctors. And knowing that is very important. I mean, I'd like to give my my personal example here. So when I was actually pregnant, I had diabetes, and I didn't know that, and I was eating a lot. I wasn't eating. Because because being pregnant is also a state where most female have cravings and
Right. I think you kind of get a pass just because you're pregnant.
exactly, that's the word we use, you get a pass. And then I got screened and for diabetes, and I failed my glucose tolerance test for pregnancy, and here I was a diabetic, and I was like, oh my god, like I'm shattered. I'm a doctor and I know the problems that can occur with having diabetes during pregnancy, and all this is running in my head, and it wasn't a very pleasant experience, or and to know that. I mean, I also have a family history that puts me at a higher risk. However, the point I'm trying to make is that once I knew that I was a diabetic, and I also have the knowledge, of how to control diabetes, and that obviously helped me. But anybody can gain that knowledge, really, either through a nutritionist. And once you have that knowledge, when you stick to the right kind of diet and physical activity pattern, you gain the right amount of weight. So your weight is not just like climbing up like that, and
Right.
that really helps to control your diabetes. And I did that. So in the last trimester of my pregnancy, in the last 3 months, I did not have that rapid weight gain, which I was having in the first two. I was very confident, and I could control my diabetes really well. And thankfully, I and my baby were fine. So that's
Right.
what yeah.
So then, do you have any tips for the mothers who are facing problems feeding their babies due to weight gain as an issue?
Yes. So, like I said, mothers, who are overweight or are obese can sometimes have delayed, um, lactation, or the milk comes late. So, one thing I'd like to say for that is, milk is fluid, right? So, one thing I'd say is that stay hydrated. Make sure that they're drinking the right amount of water. So that is one thing. The second thing is make sure you're getting a wholesome nutrition, right? That is also important. I mean, just by realizing today that, it could be like overweight could be a factor in a delayed lactation experience. They're not gonna start like jumping into making treatment options or stuff today, but we need to take care of that like right now. So these are things that they can do today, right? Making sure that they're hydrated, making sure they're getting wholesome nutrition. Other things they can do is making sure that your child doesn't have a tongue tie or something like that. I mean, we want to definitely rule out other factors and not just put this on the mother's overweight status, right?
Right.
That the child doesn't have a tongue tie or any other oral issue that can be taken care of by a doctor. And then lastly, if things are not working out, get a lactation consult, for that kind of help. And make sure that you're able to get a positive experience with the help of a lactation specialist.
Right. So I know that your article on obesity medicine and obesity care in pregnancy and breastfeeding, it's very informative. Can you tell us more about the article itself?
Yeah, so thanks for hunting down that article. And that this is also published in Obesity Medical Association website, their blog section. And really, this article talks about obesity care and their obesity care in mothers who are pregnant and with their experience in breastfeeding. And it is more detailed as to why mothers with obesity are less likely to breastfeed, or what can be done to promote a sustained breastfeeding experience for women of this group. So those are the two important points that article covers. And in our viewers, if going through this or is pregnant, I'd say that maybe they can take a look at this, and the link is in our channel below, and
Yes.
so it's available to everybody. It's an open access.
Right. So viewers, we are going to share the article with you guys so you guys can learn more about this issue. And again, Dr. Yashi, thank you so much for your amazing insight into today's topic. I am sure our viewers are intrigued and are learning a lot more. And I'm so glad to say that you are here with us today. Hoping you guys are enjoying this show. Please make sure to watch it on YUPP TV. And please make sure to subscribe to our YouTube and Facebook channel, MANATV. Again, I'm your host, Manal. And you're joined today to our show, Obesity Care with Dr. Kanica Yashi.